The word arthritis literally means joint inflammation. Where two bones touch, like in your elbow or knee, are joints. There are numerous forms of arthritis, each with a unique cause and course of treatment. Other organs, such as your eyes, heart, or skin, may also be impacted by some types. Joint discomfort, redness, heat, and swelling are all typical signs of arthritis. What causes arthritis, then? Depending on the type of arthritis, the reason varies. Osteoarthritis is brought on by the joint's deterioration over time or from misuse. Obesity, repetitive joint movements, and past joint damage, such as from a sports injury, may lead to osteoarthritis. Smoking and insufficient exercise both increase your risk of developing arthritis. Lupus, scleroderma, as well as rheumatoid arthritis are conditions brought on by the body's immune system attacking its own tissues. The accumulation of crystals in the joints is what causes gout. Genes may be involved in a few types of arthritis. Those who carry the HLA-B27 gene variant are more likely to develop ankylosing spondylitis. Other types of arthritis may have unknown causes. Some of the factors of arthritis, such as your family history, age, or sex, are unavoidable. However, there are some risk factors that you can control, such as good eating, exercise, maintaining a healthy weight, avoiding excessive alcohol consumption, and quitting smoking. Before we go any further, if you think this material is helpful, kindly like, share, subscribe, and click the notification button to make sure you never miss a video. Here are 6 foods to steer clear of if you have arthritis. Number 1. Trans fats and oils. Vegetable oils, often known as refined seed oils, are a major contributor to the inflammatory response and joint pain associated with arthritis. Oils like corn, sunflower, and soybean are readily available in kitchen pantries and grocery stores. It can be difficult to stay away from vegetable oils because they are also found in high amounts in packaged or processed meals like potato chips, hot dogs, white bread, fried chicken, French fries, and salty snacks. These oils are harmful mostly because they contain a lot of omega-6 fatty acids, which are easily oxidized when exposed to heat and light. The term oxidation describes the oil becoming stale as a result of chemical processes. These stale oils greatly increase inflammation in your blood vessels, joints, and stomach lining, aggravating chronic pain and disease. Artificial trans fats, which are sometimes referred to as partially hydrogenated oils on food packaging, are even worse. It is advised to swap out vegetable oils for healthy fats like avocado oil, macadamia oil, coconut oil, grass-fed butter, and extra virgin olive oil to reduce inflammation. Number 2. Foods high in salt. Consuming too much sodium, or salt, raises your risk of getting autoimmune conditions like rheumatoid arthritis. It might also make the symptoms worse. High salt intake can also elevate blood pressure and a person's chance of contracting other chronic illnesses like renal and heart disease, heart failure, and stroke. Ideally, people should consume no more than 2,300 milligrams, or 1 teaspoon, of sodium daily. Number 3. Foods heavy in purines. People with gout should stay away from foods that could cause a flare-up, such as foods rich in purines. Purines are substances in food that the body changes into uric acid. If uric acid accumulates in the body, a gout attack may occur. Foods high in purines include liver, beer and other alcoholic beverages, cured meats like ham, bacon, or lunch meats, and some seafood like mussels and scallops, according to the Centers for Disease Control and Prevention, CDC. A 2018 research found that various purine-rich foods, like beans, cauliflower, and mushrooms, have no associations with the risk of gout. Number 4. Foods with a lot of processing. Refined grains, added sugar, preservatives, fructose, and other potentially inflammatory substances are often found in ultra-processed items, like fast food, breakfast cereal, and baked goods, and may exacerbate arthritic symptoms. Research indicates that eating highly processed foods may raise your risk of rheumatoid arthritis by contributing to inflammation and obesity. Both inflammation and obesity are risk factors for rheumatoid arthritis. In a 56-person rheumatoid arthritis study, those who ate more processed foods had higher levels of glycated hemoglobin, HbA1c, a long-term marker of blood sugar control. As a result, eating processed meals may harm your overall health and raise your risk of contracting further ailments. Number 5. Red wine and other alcoholic beverages. It is a well-known fact that red wine includes resveratrol, an antioxidant that has been hypothesized to have positive effects on human health. Any alcohol consumption, though, has drawbacks. Liquor is not advised by scientists as a means of preventing or treating arthritis. As an illustration, consuming alcohol once a week or more may raise your risk of osteoarthritis. Drinking alcohol raises your body's uric acid levels, which can exacerbate gout. Recent studies have linked alcohol intake to an increased risk of rheumatoid arthritis in women, but not in men. In conclusion, it's advisable to minimize your alcohol intake because it may make your arthritis symptoms worse. Number 6. Drinks with added sugar. According to a 2020 study, persons who consume frequent sugar-sweetened soda are more likely to develop rheumatoid arthritis, RA. Regular drinking of fluids with added sugar can potentially cause inflammation, obesity, and other chronic disorders. A wide variety of items have added sugars. Always read the nutrition facts on breakfast cereals, sauces, and soft drinks as these items may have surprisingly high added sugar content. In order to alleviate arthritis discomfort, anti-inflammatory foods may aid in the management of arthritis symptoms. These consist of plant-based foods like fruits, vegetables, whole grains, and lipids that fight inflammation. An approved dietitian may be able to help someone with arthritis who is having trouble coming up with the ideal dietary regimen. We appreciate your viewing of this video. If you found the material useful, please share it with your loved ones. Keep checking back for future videos. Take care, and have a nice day till we meet again.